American healthcare versus Indian healthcare. American healthcare and Indian healthcare exist on two opposite planets. One is the most expensive health system in the world, spending over $12,000 per person per year. The other spends around $75 per person, the price of a dinner date in the US. So how do these two countries deliver care so differently, and why are the results more complicated than they look? Let's start with the basics. In the United States, healthcare is mostly private, insurance-based, and deeply fragmented. Hospitals negotiate prices with hundreds of insurers. A simple MRI can cost $1,500 in America, and the same scan can be $60 to $80 in India. A routine blood test that is $120 in the US might cost $3 in India. Yes, $3. India's healthcare is built around two pillars: a huge private sector and a low-cost public sector. The private system in India is competitive, price-sensitive, and extremely efficient. Doctors often run their own clinics. Hospitals compete like regular businesses. Prices are visible, negotiable, and usually transparent. And because India trains one of the world's largest numbers of medical graduates, medical labor costs are far lower. In the US, it's the opposite. Prices are hidden, unregulated, and often unpredictable. The same surgery can be $8,000 at one hospital and $80,000 at another, even in the same city. Administrative costs alone, billing, coding, insurance paperwork, account for almost 25% of US healthcare spending. In India, administration is lean. A hospital might operate with one administrator for every 3 doctors. In the US, it's often 6 administrators per doctor. But cheap doesn't always mean equal. India faces its own challenges: overcrowded public hospitals, long wait times, uneven quality, and big differences between urban and rural areas. While top private hospitals in cities like Delhi, Mumbai, and Bangalore can rival American facilities, rural areas still struggle with shortages of doctors and infrastructure. And outcomes? Here's where it gets interesting. The US spends more, but does not always get more. America has lower life expectancy, higher rates of chronic disease, and higher maternal mortality than many middle-income countries. But the US leads in medical technology, specialist care, cancer survival, and advanced surgeries. India, meanwhile, has world-class specialist care in its major cities, often delivered at 1/10 the American price, which is why medical tourism to India is booming. But at a population level, India still faces high burdens of infectious disease, limited insurance coverage, and income-driven disparities in care. So what's the bottom line? American healthcare is expensive because the system is built around insurance, pricing freedom, administrative complexity, and high labor costs. India's healthcare is dramatically cheaper because of competition, efficiency, lower costs, and a massive supply of medical professionals. America delivers some of the best care in the world, if you can pay for it. India delivers some of the cheapest care in the world, but quality depends on where you live and what you can afford. Two systems, two philosophies, two very different prices. And the big question now is, which country will manage to fix its weaknesses first? Tell us in the comments.